Wake up, America. It's time to talk about cannabinoid hyperemesis syndrome.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I've got Tina Nunziato sitting right here by my side. Thank you so much for joining us for this podcast, for this episode. And if you are a new listener, welcome. Please check out our library. We've got over 400 podcasts out there. And if you're a regular listener, thank you for being on this journey with us. We love you. We appreciate that you guys take the time. We know that everyone has such hectic schedules. So thank you, thank you. So Tina.
Yes, time for another Wake Up America.
Cannabinoid hyperemesis syndrome. That's a really long word. Can we just abbreviate that? CHS?
That sounds very fancy. It
does.
Very medically.
Yes, very fancy.
Yeah. No, but I wanted to do this Wake Up America because we have a lot of patients who are now doing marijuana because it's legal.
Right.
You know, and
exactly.
So when I'm doing consults, one of the questions I ask is, are you doing recreational drugs? And it's funny because if there's somebody like somebody walking by or in our office or whatever, and they hear me ask the question to the patient, they always come back later and they're like, do people really admit that they're doing stuff? And I'm like, yeah, they do. They tell me.
Yeah.
And there's actually quite a few people out there doing this stuff. And these are people who don't feel good.
Right. Yeah.
So I wanted to talk about that because I think because it's legal now, there's more people doing it, and they're doing it more frequently than maybe they were doing it before. Because, you know, again, once it's legal, it's easy to come by. Everyone thinks it's safe.
Exactly.
Right? And then we start not feeling good. and a lot of times, the people don't equate it at all to the marijuana usage, because some people are only doing marijuana like once a week, you know, a couple times a month, but they don't equate it to not feeling good or having some of these symptoms. So,
well, I think that there is a lot, and we've talked about this on previous podcasts, right? Like you figure if the stores have it there, in the grocery stores, for example, then it must be okay, right? And so, you know, there's a lot of trust that goes into this whole thing with, well, now marijuana is legal, and so there must be a lot of benefits to it. Okay, and I know that there probably are benefits out there. Honestly, this podcast is not to talk about the benefits of it, because we're not really well versed or greatly knowledgeable in that, because we don't promote it in our practice. Okay, however, what we are seeing more and more are patients that are coming in with symptoms that do make us question, you know, especially if they do admit to regular use of marijuana, you know, patients, these people that are coming in with these symptoms, with these gastrointestinal symptoms that we have to consider in our potential causes of what could be causing their issues, the cannabinoid hyperemesis syndrome, okay?
And I want to add to that too, because I know marijuana just became legal recently, but like we do the same thing with smoking and alcohol.
Absolutely.
Right? Things that have been legal for, you know, forever.
Absolutely.
Are still causing negative side effects in the body, and we still address them. So it's not just like we're pointing out just marijuana, or we're saying marijuana is not good for you. I mean, again, like Dr. Cruz said, I'm sure there are great uses for marijuana, but whenever you start having symptoms or you start having medical issues, you have to look at all things that are being introduced to the body that the body maybe isn't processing very well. So that includes alcohol, you know, nicotine, drugs, everything across the board.
I mean, even we did a podcast the last podcast we did was the one on Ozempic, right? I mean, if you didn't hear that podcast, please go back and listen to it, because, you know, now, as we said on the podcast, now we're starting to see patients coming in who are having symptoms which we suspect could be due to that medicine. But we can't assume it until we've done the workup. You know, we have to rule out other worrisome things like cancer and other things. So, but the thing is that because, you know, of these medicines, these new medicines that are now on the market that people are using for weight loss, because of drugs like marijuana, which now is approved and people are using it for different reasons, to help them with different medical issues, pain, anxiety. However, there are also side effects. And so now we have patients that come in, and we have to put them through a full workup.
Yeah, we have to take everything into consideration. Right?
Exactly.
Even caffeine.
Even caffeine.
The over usage of caffeine and energy drinks. Somebody presents with GI issues and they say, I'm drinking like 4 monsters a day. Like, that's what we're talking about.
Exactly.
Right? Like, it's the 4 monsters a day. So it's not, so I just want to be clear that it's not just marijuana.
No, we're not singling it out. Yeah. I mean, yes, we are singling it out in that's kind of what we're focused on today. However, like Tina said, it's not only marijuana. Okay. It's multiple things that are out there. So what is the cannabinoid hyperemesis syndrome? So basically it's nausea and vomiting, cyclic nausea and vomiting. Some of these patients have abdominal pain, and they're just like they don't feel well. They're nauseated, they're vomiting, and of course they come in and we're like, oh my goodness, what's going on? Could it be the gallbladder? If they're having pain, gallbladder, could it be the stomach? Do they have an ulcer? What's happening?
Right.
And so we do the workup on them, and typically it's patients that come in that do admit to regular use of marijuana. And so what is regular use of marijuana? I mean, you know what? I mean, everyone is so different on how they respond to a drug, their sensitivity, their makeup, their genetic makeup, all of that. So it could be somebody that maybe is using a little bit of marijuana every day, or maybe somebody that's using it once or twice a week, but maybe to them that's enough.
Right, or they've been using it for a really long time.
Exactly.
Regularly, maybe weren't feeling symptoms initially, but now are feeling symptoms, right? It doesn't have to come on immediately. It could be from regular use consistently over time, and now all of a sudden we're having these issues. Because I'll have a lot of patients, and the other symptom I find is they just don't want to eat.
Right,
right. They don't
well, they're
feel like
nauseated,
eating,
they don't feel good.
So, like when I say to them, consider coming off the marijuana. Well, that's not it. I've been on the marijuana for, a year or two, whatever. That's not it. And I'm like, well, yeah, I mean, it could be the consistent use of that over a long period of time that's now starting to affect you, right? So it's something else to think about.
Absolutely.
And just take into consideration. Like, we're just trying to throw out ideas to patients to help them get better.
Absolutely. I mean, that's the goal. I mean, people are coming to us because they don't feel good. So we're just trying to rule things out and trying, I mean, the same thing even like with food sensitivities and allergies. Sometimes I'll tell, like somebody recently asked me, they said, hey, I have irritable bowel. I know it could be my stress. I know it could be diet. And I asked them, have you done any food sensitivity testing? No, I'm not sensitive to foods. But the reality is that we have found so many patients and customers who have come in to have the food sensitivity done who are shocked because of the positive, all the different foods that come up abnormal or positive, showing that there is sensitivity. Yeah. So the same thing with medicines. I mean, it may shock you, or with these drugs, it may shock you, but yeah, like Tina said, you may have been using it for a couple years and now it's starting to hit you and you're starting to not feel well. And, if you come in to see us, we're going to do a full workup on you because we want to rule out all the bad stuff. But in the end, if nothing comes up of the workup, everything comes back negative, we have to suggest the possibility that it could be the regular use of marijuana. Just like the little, I'm not saying this to be humble, but truly the little that I know about marijuana. I mean, it can have other potential bad side effects. There has been literature that has suggested that it can cause some respiratory issues, even heart. I mean, recently, wasn't there an article that came out about heart attacks?
Yes. More frequent in people who are regular users of marijuana, but also in terms of how the marijuana is delivered, right? So whether you're smoking it like in a joint form or whether you're doing it out of a pen, a vape, stuff like that. We've had patients who react negatively to the vape because of the battery exposure in the vape. Right. So there's a lot of different things too in terms of how it's being delivered into the body that could also be affecting the overall health of the body. But sometimes I have to just dare patients, like, I dare you to stop it for a month and just see how you feel,
Yeah.
because they're like just so set on that's not it. And I'm like, I dare you. Like, if you stop it for a month and let me know how you feel. And again, that goes for everything. That goes for energy drinks. I've had to do that with patients before. I drink 4 energy drinks a day, but that can't be it. And I'm like, I dare you. I dare you to stop the energy drinks and see how you feel.
Yeah.
So,
or the 6-pack of Mountain Dew.
Right, exactly. So, these are all things that we don't, maybe again, it doesn't affect you at first, but now it's starting to affect you. The only thing to try is to stop these things to see if that will help. So,
and supposedly, I mean, one of the things I was reading is that if in the end it does turn out that, it is, the nausea and vomiting are due to the use of marijuana, they say that even stopping it for a few days can already make a difference, and people will start to feel better. Mm-hmm. So, I mean, it's definitely something that we as a gastroenterology practice have to take into consideration, because we're seeing patients that are coming in with these different gastrointestinal symptoms, and and it has to be in one of our considerations.
Absolutely. Along with everything else.
Along with everything else, that's right.
That's legal, but still not good for us.
Exactly,
Right?
Exactly. All right, well, I hope that this helped. Again, Tina and I, we just want to make it clear, we're not here to point fingers or to do any bashing or anything, but just to educate you, just to tell you, hey, this is what we're seeing. And ultimately it's information for you to take and do what you'd like with it. But we love that you've been on this podcast, on this episode with us. And if you want to connect with us, find us on our website, drlizcruz.com. There is a magenta colored button on the homepage. You can click that and schedule a free 30-minute wellness consult. And that's right, free 30-minute wellness consult. It's done over the phone, so you can do it from anywhere. If you haven't rated us, please give us a rating, and please give us a 5, because it'll help other people just like you to find us easier. And lastly, if you haven't subscribed to our podcast, please subscribe so that you never miss an episode. Thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.